The pandemic has swept the entire world for the past 20 months. It has upended the lives of almost all on this planet. North American Division decided to take a collaborative approach to addressing the needs and concerns of our church members regarding this pandemic, especially with regard to vaccination. So we thus established a task force, and that task force has been working for the past 11 months. Let me share with you the members of this task force. That includes directors from North American Division and General Conference in Health Ministry and the Public Affairs and Religious Liberties, and also representatives from healthcare institutions such as Jeffrey Kerman and Albert Rees, and also some representative from in the area of communication and also in educational area. We also have a public health researcher, Dr. David Williams, who is a member of this committee. This group of people brought their expertise on the challenge that we as a church have been facing for the past 12 months. You will find most of the church's official statements in your program booklet. It is hyperlinked, so it is easy for you to locate that. It should be easy for you to locate those background documents. Our first conversation in January of this year was to review the General Conference 2015 guidelines on immunization. So for this meeting, we invited Dr. Peter Landres to this meeting to share with us the background on this statement. Dr. Angeline Brower will also share with us some of the activities and resources that the task force has worked on throughout this year, as well as research findings. But we want to begin by inviting Olan Johnson, our Public Affairs and Religious Liberty Directors, to share with us one of the important aspects the task force has been considering, liberty of conscience.
Well, thank you, Dr. Ahn. I think one of the important things to understand is really taking a look at the total picture of how we look at what's going on in public affairs and religious liberty. I think if you go back to the beginning, Bible scholars and historians alike will probably tell you that the American Declaration of Independence was one of the first civic documents that met a modern definition of human rights. And when we start thinking about human rights, it's basically tied into the concept that the U.S. Constitution recognizes a number of inalienable human rights, including but not limited to the freedom of speech, the freedom of assembly, and also what I would consider to be most importantly, the freedom of religion. And as we consider the concepts of the freedom of a religion, that specific freedom is also inextricably tied to the freedom of conscience. Now, why is the freedom of conscience important? Well, it's important because conscience shapes human perspective, human choices, and is probably the primary identifier that distinguishes human beings from other creatures. It can be argued that the freedom of conscience is probably the foundation to all freedoms as it relates to human rights. And in my opinion, is one of the most critical freedoms that exist that can be even more important than your freedom of religion, as long as one's personal conviction does not impose an undue hardship or harm on somebody else. Therefore, if one's religious convictions do not impose this undue hardship on an employer or other employees, and there's a reasonable accommodation that should be granted, that should be the final conclusion. The primary purpose, though, of the Seventh-day Adventist Church's Religious Liberty Department, and we call that department Public Affairs and Religious Liberty because both components are important, is that we are responsible for providing support and assistance for members who are standing for religious teachings and the doctrines of our church as expressed in our system of beliefs and also in our policy statements. However, we do recognize that there are times when members have personal concerns that are even conscientious convictions that go beyond our church teachings, our church positions. And in these cases, the church's religious liberty department and its leaders would do everything that they can to provide assistance, counsel, support, and even helping in drafting and writing their own accommodation letters to their employees or others who are of concern. Now, as it relates to the vaccine mandates imposed by a number of public and private sector entities, our role in our work has not changed at all. We continue to assist both members and non-members who have issues as it relates to accommodations. Even though sometimes we may have a difference of opinion, our job is not to judge you. Our job is to assist you in whatever way that we see fit. And one person may ask the question, well, why not just allow the church to actually draft documents in its own names? Well, the reason that we try to do that is really to avoid confusion as it relates to the church's own positions and fundamental beliefs. Our church is obviously not a monolithic group, and our members' personal religious convictions can have a wide span of ideas and beliefs. And therefore, it is often the case that we have no problem in assisting an individual who has this desire. However, we try not to put advocacy to be reflected in our public correspondence or in our public communications. This is essential for the church because we have to continue to preserve the ability to speak to issues that are central to the system and beliefs and identity of the Seventh-day Adventist Church, and not allow our influence to be diluted in any way by pursuing certain personal convictions or, in some instances, personal agendas. The church's primary concern is protecting our central beliefs, our gospel, and our prophetic concerns. There will not be any individuals who come to our department to seek assistance that will not get help. All of our union PARL directors and the PARL department at the North American Division have agreed that we will assist anyone that is in need. We will help with drafting letters. We will help with even pointing out information that may be stronger in their particular cases. And we've even agreed among all of our PARL directors to operate from a specific template so that we do not create forum shopping where somebody thinks one union's language may be better than somebody else's union's language. The bottom line is that Title VII of the Civil Rights Act of 1964 has been fairly clear, and it requires employers that they have to assist if someone has a sincerely held religious belief. And contrary to popular opinion, that religious belief does not have to even be crafted in writing. The mere fact that you present the issue, an employer already is put on notice that there is a reason that an accommodation might be necessary. But it is also important to note that your religious exemption is a personal exemption. It is not a participatory denominational exemption, and that is exactly how we would want it to work. We don't want a denomination to determine the validity of whether or not religious exemption should take place. Same that the way the law is crafted, we want it to be your personal convictions. We can look across the spectrum of all Seventh-day Adventists and say that we may have different points of views on how we see things. At the end of the day, we do want to ensure that no matter what your personal belief is, that we can assist you in some form or fashion. We want to make sure that your employer understands what your rights are, and we want to also make sure that we as a church can be helpful to the extent possible. But I would also like to say one last thing. We are a church that obviously has many different opinions. We as a church will find ourselves finding that we have those who view things one way or another. However, it is still important that we as a church always communicate in a Christ-like fashion. The mere fact that we have a difference of opinion does not mean that we have to be a divided group. The reality is that division is simply one of the primary tools that the devil has used and has been very successful. If he can divide us among ourselves, he can separate us from Christ. The moment we are separated from Christ, everything starts to fall apart. So I would posit to you today that our division, our conferences, our unions will be on the same page. We want to ensure that we are helping individuals as it relates to the doctrine of our church, but also helping individuals as it relates to the conscientious rights that they may have. The fact of the matter is, I would posit to all of you today in ending, we can be different, but we do not have to be divided. Thank you very much.
What a pleasure it is to be with you today. I found it a joy as I came in through these doors. I haven't been here for a while. And I really appreciated what Elder Johnson has just said. And I was asked to share the background of the Seventh-day Adventist Church approach to immunization. In a church that has almost in its DNA, not only almost, it's germane to who we are, has a health message. Our foundations to who we are to preach, teach, nurture, and heal, to educate. And healing is one of the 4 pillars of the Seventh-day Adventist Church. And so it is that from its earliest days, the church has had an emphasis on health, not only on how we can be healthy, but how we can share health. As we look at history, we see that there are a number of interventions that have made a very significant difference in longevity over the last 140 years. And when we analyze those, we find that it's sanitation, clean water, and immunization. Those are the 3 foundations to what has changed the way we live and how long we live. It's not heart transplantation, chemotherapy, and renal dialysis, but it's those basic issues which have brought about a huge change. And so it is that throughout our history, and if we look back in the evolution or the development of immunization, the issue of smallpox was one of the first things that was faced by our church, by the decisions that needed to be taken. Should it be done? Should we not? Thankfully, smallpox today is an eradicated disease for the present. But the debates continued. They continued on typhoid, diphtheria, and many others. And we can go back into our church records and see where those issues have been talked about. So the issues related to vaccination and immunization are not new to the present. They have been with us for many, many years. Interestingly, we look in 1905, there was a court case in Massachusetts with Jacobson as to the issues related to the mandate on smallpox vaccine, and he contested it on religious grounds. It was not upheld, and he paid his $5 fine. And with those mandates in place, we note that the spirit of prophecy is silent, despite mandates being present at the time. Then we look at counsel given to missionaries, the 1930s, 1950s, and through to the present. And that is that our missionaries should be protected as best as possible. And so we also have an immunization statement crafted in 2015, a guideline, a statement, which makes clear how it is and why it is that the church has guidance on this issue. And what it states is that we place a strong emphasis on health and well-being. This is based on biblical revelation, the inspired writing of Ellen G. White, one of our co-founders, and on peer-reviewed scientific literature. Those are the 3 foundations we use in evaluating health ministry. As such, we encourage responsible immunization or vaccination, and have no religious or faith-based reason not to encourage our adherents to responsibly participate in protective and preventive immunization programs. We value the health and safety of the entire population, which includes the maintenance of herd immunity. Importantly, we are not the conscience of the individual church member. We recognize individual choices, and these are exercised by the individual, as has been so eloquently stated. The choice not to be immunized is not and should not be seen as the dogma or the doctrine of the Seventh-day Adventist Church. That is a guideline for immunization in general, and when COVID-19 came, the same principles have been applied to COVID-19 vaccinations. And subsequently, an affirmation of what the Church responds and how it responds to COVID-19 has been crafted and shared and is based basically on the issues that have been mentioned, on the individual choice, the conscience of the individual, but also clearly stating that the Church is in favor of healthful living. And here is a very important area to underline and to emphasize as I close. The Church has in no ways moved away from the principles of healthful living. Those remain the foundation and the cornerstone of prevention, of well-being, and of staying healthy. However, that alone has been shown in situations as we face right now not to be enough alone. And so we encourage responsible immunization at the discretion and choice of the individual in consultation with their healthcare professionals. Our appeal is also that we should be kind, caring, non-discriminatory. We should listen, we should care, and we should live together in peace and unity by His grace.
Thank you. Thank you, Dr. Landless. We appreciate that very much.
We now turn to look at some of the activities of the task force over this past year. One of the first things that we wanted to do was to have a central location to share the communications from the church. So we did develop a website in partnership with our communications team where you can find all of the statements that have already been mentioned, and as well as other information and resources. Simply go to nadadventist.org and you will see the spotlight section and click on Read More. On this website, as I mentioned, you will find the church statements as well as some articles, videos, and related news. In addition to that, very early on, the task force decided that we really want to hear from our own church members. So we initiated a research study looking at the Adventist perspectives on COVID-19 vaccines. We're very thankful for Dr. Peter Sinkala from the Institute of Church Ministry, who has been conducting the research, as well as Dr. David Williams, who has been lending his expertise. What we did was we selected a random sample of 500 churches in the US and Canada, and they were representative of the overall makeup of our churches in this territory. And a 25-question survey was sent to our churches. They could either respond using a paper survey or online. To date, we have received a little over 1,000 responses. So these are self-reported responses to the survey questions. We're going to take a very quick look at some of the data here, but I want to let you know that this is really a raw look at descriptive data. So we want to be careful in drawing too many conclusions at this point. We still have a good deal of analysis to perform. So on this current slide, we see that overall, 67.5% of our church members report that they have either partially or been fully vaccinated. Looking at this by gender, we do see that about 70% of women and 60% of men report being vaccinated, at least partially. If we look at the data comparing the location of the church, we see that inner city and metropolitan area churches seem to have higher rates of vaccination of about 80%, and that becomes increasingly lower as we go into more rural locations. A similar trend seems to appear when we look at the size of the church. Larger churches appear to have higher vaccination rates of about 90%, and that, again, decreases by size of the church. We've also asked respondents their level of familiarity with the statement that Dr. Landless just read for us. And the first thing to point out here on the table is that only about 36% of individuals state that they have no familiarity at all with the statements from the 2015 GC statement or guidance on immunizations. And I think this tells us that we need to do a better job of letting our members know when information is available. And so this is an important thing that our church members do want to know. I've had conversations with many of them over the past few weeks, and really many of them do not know that the church even has a statement. If we also look at the data there about, we see somewhat of a trend with corresponding to familiarity with the statement. But again, we cannot say at this point if that is statistically significant. More analysis will be performed in the future. We also had about 175 individuals who said that they would be willing to talk to us doing a phone interview so that we can ask them more information, gather some more details about their thoughts and opinions about the vaccine. So we look forward to engaging in that in the near future. Again, also with doing more of the detailed and rigorous analysis of this data. We do, as I mentioned earlier, have 25 questions, and so there is quite a bit of data here that we're looking forward to look into. The final resource that I want to share with you is on a different topic, but one that the task force felt was very important and certainly met a great need. And that is the need of building up our church family at this time. We know that there has been much tension on this topic. And it has been devastating to hear of some churches who have gone through incredible challenges in having conversations on this topic, and sometimes perhaps even coming close to splitting over the disagreement. So we wanted to build a space where we could offer healing, comfort, and togetherness. And so what the website that you see on the screen now, I encourage you to take a picture of that screenshot or to go to that website link right now and look at the resources that we have provided there. I'm going to go through a few of these items, but please peruse them at your leisure. My pandemic story, this is something that we're very excited about because there's an opportunity to find healing through storytelling. This began as a way to encourage our children and young adults to use their creative talents of writing, drawing, music, or other arts to share their stories and their experiences of living life through a pandemic. Well, we had demand from our older members to also participate in this. So this is open to all of our members to tell us, what has life been like for you? We also know that many individuals have lost loved ones during this time. So there's this place to share a photo and a memory of your loved one. So together we can grieve with one another and go through that process of healing from our losses. acts of prayer, a place to place our prayer requests during this time, because prayer is also healing. There are resources for practicing self-care, resources for continuing ministry during a pandemic, because we want ministry to continue. We will also be releasing frequently asked questions about the vaccines in the near future. And there's a link there for where you can find the information on the vaccine exemptions. Numerous webinars have been held over the past 2 years discussing different topics related to the pandemic, the vaccines, and so they're all linked there, so we encourage you to take a look at those. And finally, also, we've heard Dr. Landless mention some of the early writings of our Adventist pioneers discussing vaccines and vaccinations. We do have a link there that currently includes articles from the Review and Herald and from Life and Health magazine. This is an time-intensive process to look through all of the issues of our magazines, but you will find there ones that are published during the lifetime of Ellen White. So really, as the others have shared with you, this is a time when we as a church are called to press together. And it is our prayer that these resources will help us to engage one another in healthful and heartfelt conversations with one another as we seek to achieve the mission of our church.
Thank you, Dr. Brower. Thank you very much. We appreciate that information.
Mr. Chair, the task force will continue to meet to address the question and needs that arise collaboratively. And this is the report from the COVID-19 Task Force. I move that we receive this report, Mr. Chair.